So the first question there is: a newborn is diagnosed with congenital toxoplasmosis. A CT scan shows multiple periventricular calcifications. Serum calcium and phosphate level are normal. Which type of calcification is occurring? So here we have what? We have a infected tissue with toxoplasmosis, right, which is a form of what? A degenerating tissue or a necrotic tissue, right? And as a result of that, that give opportunity for calcium to deposit in those tissues. So this is going to be a form of dystrophic calcification. Moving on to the next one. A patient with end-stage renal disease on dialysis. And what do we mention about end-stage renal disease? It can lead to hyperphosphatemia, right? So those patients who have increased phosphates develop increasing shortness of breath. Chest X-ray shows diffuse calcium deposits in the alveolar walls. Lab studies show elevated phosphates and a decreased calcium. What is the most likely mechanism? So this is going to be a form of, so a patient who has end-stage renal disease, elevated phosphates, and decreased calcium level. Can somebody remind us what's going to be the parathyroid hormone level? Very good. So there's going to be increase in parathyroid hormone level. So this is going to be a form of secondary hyperparathyroidism. Very good. Make sure you remember. You're going to come back and thank me. So which of the following is the most likely mechanism in this patient? So this is going to be a form of what? Metastatic calcification. So the best answer there will be C. So hyperphosphatemia causing calcium phosphate deposition in normal tissue. So next question. 44-year-old woman is found to have a thyroid mass. Histology of the mass shows concentrically laminated round calcification, right, known as Samama bodies, right? Which of the following tumors is the most likely present? So this is going to be a case of what? Papillary thyroid carcinoma. And remember, papillary thyroid carcinoma, one of the main risk factors when you are reading the question is going to be exposure to radiation. So somebody who have prior exposure to radiation now develop thyroid mass and the experience of Samama body or orphan hiney nuclei. Think of papillary thyroid carcinoma. And the last question for today, guys. A 50-year-old man with long-standing type 2 diabetes presents with polyuria, polydipsia. Imaging shows calcification of the renal collecting tubules or ducts. Labs showed elevated calcium level and a low phosphate. So elevated calcium level, low phosphate. So this could be somebody who have what? Very good. Primary hyperparathyroidism. And what are the causes of primary hyperparathyroidism? Very good. It could be adenoma, particularly if just one gland is involved. It could be hyperplasia if all the 4 glands are involved, or it could be carcinoma. Very good. What is the most likely cause of this? So this patient, because of the hypercalcemia, likely have nephrocalcinosis, thereby leading to nephrogenic diabetes insipidus.